we should have a synchronous growth of the follicles. In case we don't have synchronous growth, this means that we have started with an asynchronous ovary. So what we normally do is, we are so scared of each other. We are so scared of each other that in case, and nowadays patients are also changing. They're in a hurry. And I don't know why. I think they also have money nowadays. I don't find they are saying that we cannot afford it. They demand it because they don't have time. Time is money, they know it. So as a result, what happens? They are in a hurry, and all of us are not even making proper diagnosis. That I'll be covering. I've given a chart to you. I ask all of you who are doing IVF, can you justify yourself doing an IVF? And 99% of cases when I assess, you are not. You are doing it because you feel we should do it. Patients are 3 years of marriage, 4 years of marriage, they're in a hurry, jaldi kar do, we do IVF. So IVF should not be done in case any woman has got open tubes, one or both. In case the tubes are open and his sperm count is more than 4 or 5 million total, or 6 million post-wash, but his sperm count, they have to go for an IUI, not IVF. Unfortunately, large number of IVFs which are being done, they are being done for wrong diagnosis. We don't even diagnose properly. So in that, once you change it, you'll find that IVF rates will come down.
So how many IUI should be done before?
3.
3 only.
We follow 3, but the guidelines say it can be 6 to 9. But I will say that
that's
3
what
IUIs.
we see, 3 IUIs and then the advice ki go
No, but
for
madam, 3 IUIs should be done by the proper way. See, everyone is not trying to do IUIs everywhere. But when you do IUIs have to be properly planned. Now, how many of you do your own semenology? I just want to ask you. 1, 2, 3, not many people. So you're dependent upon the technician half the time. In case you are convinced that your technique of IUI is correct, it's a very simple process. If you have done it correctly with the right indication, then I think it's
3 is
good enough. Then you move. But half of the time people don't know what they are doing, and we're in a hurry, we do mistakes.
So just stimulation care, just like I've started with this stimulation. On day 2, I'm looking at a synchronous.
Mic दे दीजिए, mic. Switch off the AC. AC को switch off कर दो.
And now on day 2 of cycle, I have called my patient, and when I'm looking on ultrasound, I am having a like AFC count of 8 to 10.
This I'll cover tomorrow.
Okay.
These I think I'll cover tomorrow. So because we have to focus on OPU today, just remember that your synchronous follicles are, they say 2 to 9 millimeter, 2 to 8 millimeter. That's average size. But only issue is that we start our cases when there are 2 follicles of 9 millimeter, and rest all are 2 or 3 millimeter. That is an asynchronous crop.
Yes.
Synchronous means all are 4 to 5 millimeter or 6 millimeter or 7 millimeter, all of the same size. What happens is that we start when 2 are 9 or 10 and rest all are 4 to 5. Then we start pushing it up and we find 3 big follicles and rest all are small. This is asynchronous growth.
And so how to ensure? So we have to make sure that the
Wait for a day.
Yeah, no. Then cancel it. But this part I will be covering FOI. The thing called FOI. We have FOT, that is how many follicles, retrieval output. Then we have got FOI. So these indices, this I will be covering tomorrow.
Something about OPU again.
OPU only. We talk about the technology of OPU.
Sometimes in hyperstimulated ovary there is lots of fluid inside. So when I'm trying to do kind of the OPU, in spite of trying to localize the ovary or like push it against the pelvic side walls, whenever I am trying to puncture the vaginal wall, there seems to be a space in between with the fluid and it doesn't go.
This is what I'm trying to tell you. It's your mic, by the way. So see, you have to have mic when you're speaking. So make it a point that when you're speaking.
Dr. Payal Sen. I'm talking like in sometimes when there is a little bit of hyperstimulation, there is lots of fluid in the pelvis, but we have to do the OPU. There so happens, in spite of trying to push the ovary against the pelvic wall and fix it, still there is a layer of fluid between the vaginal vault, and sometimes it so happens when I try to puncture the vaginal ball to reach the ovary, it's kind of dense,
Yes.
and then I get scared. Ki what's happening?
In such a case, you can do two things. It's rare. Rare. You can aspirate that fluid.
Acha.
You got some cavity. But she has some protein loss, you can aspirate that fluid so that no ovary will come near you.
Okay.
But the better method is that agar ovarian hyperstimulation hai, in case it is an stimulated ovary, this means that she will be having 10-15 follicles minimum. 15 follicles means a 30 centimeter ovary. Approximately.
Yes,
The
sir.
15 follicles may be 5 here, 5 here, 5 here. But this will give you an ovary around 10 to 15, 12 to 15 centimeter. So it is a huge ovary. This ovary, please keep our mobile inside here.